Jennifer Bradley, Clinical Nurse Manager for Peri-Operative Services. I'm the manager for PAT, which is pre-anesthesia testing, the pre-op holding area, and the PACU area, which is post-anesthesia care unit. So I manage all three of those areas, and I also staff in them when I'm able to. Staffing's my favorite part. I love a busy surgical day like today. I think it matters a lot because we take care of patients when they first are scheduled for surgery. They come into PAT and we get them ready for surgery to make sure they're in optimal condition, what we can do, what we can address, tell them then what to expect for surgery. And then in the pre-op or holding area, we get them ready for surgery and keep them comfortable and helps keep them calm. And, if they need pre-medication, we give them meds for surgery. And then in the recovery room, we take care of them after surgery and make sure they're comfortable and warm and they're not nauseated, My best days, so I've been here over 26 years. There's been a lot of best days. Hurricane Florence, we were here. I think we spent like 4 or 5 nights at the hospital, and some people had to stay here to make sure we took care of the patients. And there were people coming in from outside areas where they were flooded and they would sleep at the hospital too. It doesn't sound like it would have been a best day at work, but through that time, like we were in downtime, we would play games and work on our dance moves, and we really bonded together. During all that terrible time, like everything is crashing around us, we came together as a hospital and as a team to help people that needed surgery or needed care, because hospitals don't close down. I was just really proud of everything that we did and proud of all of us and the care that we gave. Well, my mom had multiple sclerosis, so growing up, so it made me tearful. So growing up, it was pretty terrible. And I felt like she suffered a lot with that, because this was a long time ago. And that inspired me to have a job that was important, not important, but where I cared for people and I made people's lives better. But I wanted a job that mattered, that I could be proud of. And I am proud of that I'm a nurse, and I'm proud of the care that I've given over the years. And I'm proud that my daughter is also a nurse now. I've inspired her to become a nurse, and she works in a PACU like I do. The most important things to me are that people are team players and that they're flexible. I feel like in nursing that is the most important thing. Anything in healthcare, that's what I tell my nieces and nephews, my friends' kids, go into healthcare, anything in healthcare, because you're always going to have a job, anytime, anywhere, anyhow. There's a million different jobs in healthcare, and it's never going to go away. People are always going to need caregivers. There's evening jobs, there's night jobs. There's so many jobs in healthcare, and there's such a need, and it's just such a job. I think it's important to other people to have a career that you're proud of. That's an easy one. We have a great team here. I'm very proud of the team that I work with. I have some of my best friends are people that I've worked with, when I started in nursing. When I started in nursing as a new grad, I thought, well, I'll take this job and to see what I really want to do. And I stayed on that floor for 10 years. It was a surgical floor, and I just loved it. All the lines and tubes and drains and dressing changes and helping people get better and go home. Made a lot of really good friends, in those first 10 years that I worked here, and they're still some of my best friends. And, people have gone on to different careers in different areas, but now in my new area that I've been in for like 16 years, I've been friends. I've made a lot of really good friends, from the nurses to the anesthesiologists to the CRNAs to the surgeons. Everybody is a close-knit team. And we enjoy doing things outside of work. We do. When somebody gets sick, we make them food and take it to their house. When somebody has a baby or gets married, we're doing wedding showers and baby showers, and the team spirit and the closeness and the family atmosphere really shows through, but it also shows throughout the hospitals.